Good morning, America, and good evening, India. The novel coronavirus so far is known to be kinder to kids, but the virus struck a 40-day-old infant hard, pushing him into the ICU for several days with severe infection. The baby fought tooth and nail for more than 3 weeks, surviving 8 days on mechanical ventilation to finally defeat the virus. All of 63 days on Thursday, he was bid a fond farewell by the staff at the Institute of Child Health, Kolkata, which helped him fight the battle despite being a non-COVID hospital. To the best of our knowledge, this infant is the youngest COVID patient in the country to develop severe critical infection, needing pediatric ICU, PICU, support and mechanical ventilation, and then winning the battle, said ICH Pediatric Intensivist Prabhas Prasun Giri. When the new parents brought the baby boy to ICH on July 28, he was suffering from fever, convulsion, and breathing distress. Admitted under neonatologist Kia Ghosh Uttam in the neonatal intensive care unit NICU. Doctors suspected to be a case of COVID infection. The baby's swab samples came back positive on July 30. Since ICH is not a facility for COVID treatment, the hospital initially decided to shift the baby to Medical College Hospital that has a dedicated pediatric COVID ward. The bed was even arranged at MCH by Swasthya Bhavan officials, but ICH doctors did not want to take the risk of shifting the already critical child and decided to treat the patient themselves. The infant was on high mechanical ventilation and had low blood pressure. There was the possibility of losing the child while being shifted to another hospital. So, we decided to treat him at ICH, said Giri, who headed the team that took care of the baby. The doctors, however, had to keep the infant in one of the 2 ICU beds in the isolation ward for suspected COVID patients, as shifting him to PICU would have posed a grave risk to the other seriously ill children admitted there. With supportive medication, the child's condition began to improve and the doctors were able to pull him off ventilation on the 9th day. He also tested negative to the virus on that day. It was a risky decision to treat the infant at the hospital, but the doctors here are so passionate about taking care of sick children and that I give them a free hand. I am especially proud of Dr. Giri for taking such a risky decision that went off well, said senior pediatrician and director of ICH Apurva Ghosh. Though the ICH has a 37-bedded isolation ward with 2 ICU beds for suspected COVID patients, the hospital has not been able to set up a ward to treat COVID-positive patients due to the building's old design. The ICH has so far detected about 22 positive cases, most of them asymptomatic or mildly symptomatic. Incidence of COVID-19 is usually less in children, and most of those infected are either asymptomatic or mildly symptomatic. Severe infection needing PICU care and mechanical ventilation is very rare, said Giri. In an attempt to trace the source of infection, ICH doctor asked the baby's parents to get themselves tested. Initially reluctant, they agreed a week later, but turned out to be negative. The baby was born to the Kontai-based couple, though a C-section at local nursing home. Doctors at the ICH felt the parents could have picked up the virus earlier but did not have it when they got tested. BN Das report, Pusat TV USA.